Hello, before we get into the content of this video, I just wanted to add that I am thinking about doing a Q&A video. So if you have any questions at all on the mental health profession or on LCSW exam prep series or any LCSW exam questions, whatever types of questions you may have, please leave them in the comment section below because I plan to answer them in another video. Otherwise, you can go to my Instagram page, Mental Health with Melissa, and leave me any DMs there with questions. Anyway, let's get right into the content of the video. Hello and welcome back to my channel, Mental Health with Melissa. Today we're going to be looking again at the LCSW categories exam series, as I've been doing for my past few videos. If you're new here, my name is Melissa. I'm a licensed clinical therapist, a licensed clinical social worker in particular, a clinical supervisor, and a PhD psychology research student. Before we get started, please don't forget to hit that like and subscribe button for more content like this. I post videos every single Sunday and Wednesday, and subscribing to my channel really helps me get mental health information out there to our communities of color and to those that are interested in the mental health and behavioral health profession. So today on our categories on LCSW exam series, we are going to be continuing on to assessment and treatment planning. If you haven't seen my video on the categories on LCSW exam breakdown, I'm going to leave it in the description box below, so don't forget to check that out. We're going to be exploring assessment and treatment planning today, so let's go ahead and jump right in. So what I like to do, as you may already know, is break down the question and the vignette before looking at the options. You will find a majority of the time, if not all the time, the answer to really be in the question. So let's go ahead and read it, break it down. As always, please pause it here, read it on your own, explore the options, write down what you believe the option is and a quick sentence or two about your rationale. And then when we discuss the correct answer, I want you to compare and contrast the rationale and the correct answer to yours. Okay, let's get started. During Mrs. Apple's first appointment in a family agency, so let's go ahead and start marking it up. First appointment. The social worker encourages her to express her feelings about the recent placement of her child in a residential facility for the developmentally disabled. So she just recently had her child placed. Mrs. Apple talks at length instead about her own mental health problems. Okay. The social worker should... So let's take a look about why we broke down the question in the way that we did. So this is an initial assessment, an initial appointment. So this is the first time the social worker is meeting with the client. And so we want to make note of that because that has a lot to do with how we may respond or intervene. We want to know about what's going on. So her child was recently placed in a facility, so it's the child is no longer under Mrs. Apple's care. So what does the social worker need to do? Option A, use Mrs. Apple's remarks about her health to identify unresolved parenting issues. Okay, so that's interesting. Use Mrs. Apple's remarks about her health to identify unresolved parenting issues. Now, do we know that Mrs. Apple has unresolved parenting issues? This is our very first assessment of Mrs. Apple. So as I've mentioned before in other videos, it's not always safe to assume. We want to be able to explore. So explore is a very key terminology in the options in these types of videos. So this may not be the best follow-up thing to do. Option B, refocus the interview on the child's behavior and the reason for the residential placement. Okay, well, this seems like an important thing to do because we are meeting with Mrs. Apple as a result of the recent placement of her child. However, again, this is why this is a key component of this question. This is the very first appointment that Mrs. Apple is having with the social worker at the family agency. Now, this is an important thing to do But is it the thing that the social worker should do during the first appointment? Well, let's take a look at the other options. Option C, explore with Mrs. Apple how her health problems are related to the recent placement of her child. Well, again, this is an important thing to process and explore. Like I mentioned earlier, explore is a very key term. We want to give our clients the option to explore their feelings. So this could very well be a important part of maybe the first appointment or maybe the second appointment. But let's take a look at option D to see what that says. Listen to Mrs. Apple's description of her health as a beginning of a relationship and means of assessing her self-perception. D sounds like a very good option because, again, we're going back to here in the question. This is the very first appointment. This is somebody that has just experienced a loss because she had to place her child into a facility and she's no longer the primary caretaker of her child. And if you're meeting with her for the first time and she has some presenting concerns that she wants to talk about, this is going to be a really good way to build rapport. All of these other options may be very important to also bring up, but the most important part at this point is to allow Mrs. Apple to really talk about what's going on with her, build that rapport, and then further begin the relationship and use that as a means of assessing her self-perception. So assessing is another key term here because, again, first initial assessment, we're assessing her self-perception and we are allowing her to build this relationship and this rapport with us as her new social worker. So D is going to be the most appropriate answer for this particular question. Listen to Mrs. Apple's description of her health as a beginning of a relationship and means of assessing her self-perception. I hope that was helpful. Thank you so much for watching. Please don't forget to hit that like and subscribe button for more content like this, and leave any questions you may have in the comment section below. Until next time, managing mental health matters.